Well, we started treating, of course, with beta blockers, and the first gradient we measured when the patient visited our hospital was during rest 75 millimeters of mercury. Now we remember what we measured now. It's way, way, way lower, so approximately 15 to 20 millimeters of mercury. We still are going to measure all our measurements, but now it's, for me, very important as we have the patient here, and he's receiving a new medication for the form of hypertrophic obstructive cardiomyopathy, Mavacamten. I want to ask him how he's doing. Also, jetzt noch einmal die Frage, wie geht's dir jetzt?
Super, so wie wirklich bin ich voll zufrieden und ich spiele selber, dass ich viel mehr kann unternehmen, dass mir viel besser geht.
Super, das heißt, dass insgesamt geht es dir jetzt wesentlich besser, als was wir begonnen haben.
Genau.
Okay. So to translate, he's feeling way better compared to when we started with the medication, and he's now able to do way more, has less symptoms, and also his heart is doing overall better. So the NT-proBNP levels were declining from approximately 3,000 to 1,200 nanograms per liter in our case, and he's receiving it for approximately 2.53 months. Also, we do not have actually a relevant gradient during exercise and rest. Now, as we have finished our evaluation of this patient with the hands-on part, we are going to move on and do some measurement.